אז בעצם המציגה האחרונה שלנו היא אריאל קיים.
If it's okay, I'll speak in English as it's my native language. My name is Arielle Kaim. I'm a doctoral student in Bruria Adini's lab in the Faculty of Emergency and Disaster Management in the Faculty of Medicine. Today, first of all, I'd like to thank the center and also Bruria and all of my mentors, Moran Bodas and the Reswell Center, for sponsoring everything that I do. This is a project that started not in relation to my PhD, but something that was just happened to come along because of COVID. So the topic of today is called Compliance of the Public with Governmental Regulations and Recommended Protective Health Behavior during COVID-19 and Capacity Building with Brief Educational Interventions, the lessons learned from our varied waves. So just to get started, in response to the global increase of reported cases and deaths, the outbreak had of course resulted in unprecedented public health measures that were very much extraordinary and unprecedented in order to reduce further spread of the virus. And to inform these efforts, of course, the world had looked to previous outbreaks, including MERS and SARS. And one of the key lessons that was taken away from the previous outbreaks was really the need to engage the importance of cooperation and engaging the public in order to result in relieving outbreak burden. And this was one of the key takeaways that we had taken in kind of some of the work that we had engaged in throughout the pandemic. So, of course, as we said, that in the context of the pandemic, rigorous and unprecedented public health measures were invoked. And in response to that, we saw various hurdles that were encountered, whether that was vaccination hesitancy, also hesitancy to socially isolate. So this is some of the key work that we were engaging in. So what you see here is something that we had conducted throughout the first wave. We had assessed what were the key factors that impact on uptake and adherence to control measures throughout the first wave. Again, to contextualize this is the period that we're in the first lockdown. And what we see here is actually the factors that enhance compliance to governmental directives. The most important factor was believing that this staying at home protects the family as well as protects the individual. And the least important factor was a fear of receiving a financial fine or other. And the factors that actually impede compliance to governmental directives was a desire to live a normal life routine, as well as fear of economic loss. And the least factor that we saw as impeding compliance was the lack of the faith in the effectiveness of the actual measure that was being implemented. So this is just to contextualize some of the key factors that we had observed throughout the pandemic as being important to compliance, to specifically social isolation. So in the same study, what we looked at were correlations between resilience, distress symptoms, and factors impacting on compliance. What we had observed was a negative correlation. Correlation was found between levels of resilience and distress symptoms, as well as a positive correlation was identified between resilience and factors that enhance compliance with home isolation that I had just shown in the previous slide. In addition to that, a positive correlation was found between distress symptoms and the factors that impede compliance with home isolation. Most of this is pretty self-evident, but it's important to nonetheless point this out. Now we're moving on to the third wave. What we had done was actually we wanted to assess whether or not vaccination status had any impact on compliance to the various other NPIs. So that includes mask wearing, social distancing, etc. And what we actually saw was that that there was differential compliance to the varying NPIs as a result of the vaccination status. So for example, those that were already infected, of course, started to reduce their compliance to the various NPIs. And this is a very important message as it's understood from this that we must start tailoring our information to this population as well, despite the fact that, yes, they were infected. Maybe they feel less fear now as it's no longer a novel threat. We've already gone through it, but still, there's still importance in translating information and tailoring risk communication to these specific groups and this population. Then moving on to the fourth wave, once again, we had assessed the factors that impact on uptake and adherence actually to vaccination as the vaccination campaigns had begun. What we had seen here is that actually at this stage in the pandemic, pandemic fatigue had begun to have cascading effects also on vaccination. So at this stage, actually trust in authorities and even threat perception components such as concern and fear of contracting the disease were incapable of actually predicting vaccination uptake, and rather the perception of the importance of the vaccine and its effectiveness were predictive of vaccination uptake. So all of the fear mongering that was going on at the beginning stages during the first vaccination campaign, if you don't get vaccinated, it was no longer working. And at this stage, we need to again adjust our communication and adjust our risk communication to specific groups and populations. So then we came about and we said, what can we actually do about this, right? We're in a state where we see all of these factors coming to play. What can actually be done about it? What are actually practical ways that we can enhance compliance of the public? And one of the things that we asked was, could we use brief educational interventions to actually impact on the discussed factors in the context of COVID-19? So we had conducted two studies, the first one being that was conducted in March 2020 in the initial phase of the pandemic. We wanted to assess whether or not a brief educational intervention with the assistance of MADA, our national EMS system, if we were to create a very short 6-minute long intervention with the assistance of a EMS member dressed in a paramedic uniform, would that have any impact on compliance? In our case, intended compliance. So we focused this short video on relaying knowledge, COVID-19 characteristics, etiology, transmission routes, and guidelines. And again, this was at the initial phase of the pandemic. In a few seconds, I'll show you some of the results. The second study we had done was, once again, very similar methodology. We had used, in both studies, approximately 500 individuals, members that had joined our study. Here we were actually focusing on vaccination attitudes. Once again, we had utilized MADA as a MADA representative to help us in delivering the information. We had developed this intervention in conjunction with them. And this was actually done in January 2021 in the initial phase of the first vaccination campaign. So fast forwarding, I want to show you some of the results from the first study. Here, again, with the variables that we were assessing for was a pre and post intervention assessment. The variables were knowledge score, knowledge perception, perceived safety, perceived personal resilience. As can be predicted, we saw significant change in all of these variables. We saw a 12.4% change in perceived safety, 7.8% change in knowledge score, knowledge perception, and perceived personal resilience. This was an indication to us that it may be a useful tool to start integrating, obviously at that state in the pandemic, but we also wanted to assess that, as I said, with vaccinations and vaccination attitudes. So here we go, and here are some of the findings from the second study that we had conducted. Once again, before and after viewing of the vaccination video, we saw a significant difference in knowledge, resilience, trust in authorities, vaccine importance. We actually didn't see a significant difference in vaccine trust, which is quite interesting. A feeling of protection also was significant. So these were some of the data that we had observed with regard to the two interventions that we had developed. So just to provide a bit of analysis and conclusion, from this data, we deduced the importance of utilizing tools for, of course, empowering the population rather than instilling fear, right? Some of the data that we showed previously was the fact that fear doesn't work. It's not a useful measure in inducing compliance. It just doesn't work. It might work for a very short period of time, but in the long run, it has no impact on compliance. And for that matter, we see that educational interventions such as the ones we developed may be more effective approaches to actually increase compliance. So with this being said, we're definitely advocating for such an intervention to start integrating it into some of the SOPs, for example, that of the Misrad HaBriut, et cetera, and various other authorities. The second element being that the results highlight the importance of adapting and adjusting risk communication efforts in order to accommodate accommodate the various concerns and hesitations demonstrated by the various groups. So for example, we saw that the population that was already infected once, right, they stop following through with the various other NPIs. And this is an indication to us that this population may think that the pandemic or the disease is no longer relevant to them. But as we saw, as the pandemic was ongoing, we saw the development of various other variants, as well as what's called as waning immunity. As all of these things are very necessary to convey to the various populations during an evolving pandemic. This was one of our other takeaways. And lastly, of course, that the public health officials and authorities must engage the public in resilience building activities in order to promote compliance during both times of normalcy as well as during times of crisis. Beginning to actually build capacity during the pandemic is not really the right time to start doing that. We must start before, and unfortunately, we're not advocating enough for this, I believe, as the scientific community, but really this is something that we must bring in to the norm. So just a few recommendations. Obviously, what we see in these studies is that we're not evaluating uptake of actual behavior. We're just evaluating intention, which is, I believe, one of the major limitations of studies such as the ones that we were doing. The second element being, of course, that, as I said, administrating interventions and building trust starts during times of normalcy in order to get the public prepared. Otherwise, it's sometimes too late, and thus we must begin it now. And lastly, what we saw is that societal resilience is associated with behavior, so we must build it. So that's all for me. Thank you very much, and I'm happy to take any questions.
תודה רבה. רק תיקון קצר, יש לנו עוד הרצאה, בסדר? אז לא להיעלם.
So you provided a part of an answer to my question, but were people that recovered after infection less prone to complying with NPIs than vaccinees?
That's right. So actually, yes, I didn't show these with me. It was in another study that I conducted separately, but yes, very much so. We saw that the individuals that were more, the individuals that were more likely to get vaccinated were actually more compliant overall to NPIs as a whole, and the population that was, as we said, that had whether they had been infected, they were less compliant. So the answer is yes, we saw a difference. Yeah. So,
תודה רבה.